As we age, our bodies send important signals that we shouldn't ignore, especially when it comes to seniors. Doctors have identified 5 surprising signs that may indicate that the end of life is near. Recognizing these signs early can help families and caregivers provide the right support and comfort during this critical time. Whether it's subtle changes in breathing, sudden weakness, or other unexpected body signals, being informed empowers you to prepare with compassion and care. In this video, we'll break down these crucial warning signs to help you understand what to watch for and when to seek medical advice. Stay with us to learn how to recognize these signals and offer the best care to your loved ones. Lesson 1. Understanding the body's final signals. As we grow older, our bodies go through many changes, some more noticeable than others. But did you know that toward the end of life, the body often sends subtle signals to let us know something important is happening? Understanding these final signs can make a huge difference, not just for seniors themselves, but also for their families and caregivers. Recognizing what the body is telling us helps provide the right care, comfort, and peace during this crucial time. One of the key reasons to learn about these signals is that they often go unnoticed or misunderstood. Many people assume changes like fatigue or slight confusion are just normal parts of aging. But in reality, they can be important clues that the body is preparing for its final phase. By paying attention and knowing what to look for, you can help ease suffering and provide support that truly matters. So, what exactly are these final signals? While every person's journey is unique, doctors and experts have identified some common physical and behavioral signs that often appear near the end of life. These include changes in breathing, decreased energy, shifts in consciousness, and more. Each signal tells a story about how the body is gradually slowing down and shifting focus from everyday functions to simply maintaining comfort. One of the earliest signals might be a noticeable drop in energy. A senior who was once active may suddenly start resting much more, showing extreme tiredness even after small activities. This fatigue isn't just normal tiredness, it's a sign the body is conserving energy for vital processes. It's important for families to recognize this change and adjust expectations and routines to prioritize rest and peace. Another important sign is changes in breathing patterns. You might notice irregular breaths, pauses, or shallow breathing that comes and goes. These changes can be unsettling to witness, but they are common and reflect the body's natural response as the lungs and heart begin to slow down. Understanding this helps caregivers remain calm and provide comfort rather than panic. Behavior and awareness can also shift. Seniors may become less responsive or more withdrawn, sometimes seeming confused or disoriented. These changes don't mean they are suffering, but rather that the brain is adjusting as the body prepares for the final transition. This is a time when gentle communication, soft touches, and a calm presence can be incredibly reassuring. Skin color and temperature might also change, sometimes becoming paler or cooler, especially in the hands and feet. These changes happen because circulation slows as the body focuses energy on essential organs. Recognizing these signs helps families understand that physical changes are part of a natural process and not necessarily a cause for alarm. Why is all of this knowledge so important? Because when families and caregivers understand the body's final signals, they can make better decisions about care. It allows them to shift focus from trying to fix every symptom to providing comfort and emotional support. It helps prepare everyone emotionally, making the final days or weeks more peaceful and meaningful. If you or a loved one are experiencing these signs, it's a good idea to talk to healthcare professionals who specialize in end-of-life care. They can offer guidance, pain relief, and emotional support tailored to each person's needs. Ultimately, understanding the body's final signals is about compassion, respect, and dignity. It's about recognizing that life's final chapter is as important as every other chapter, and that with the right knowledge, we can make that time as gentle and loving as possible. Stay tuned for the next lessons where we will explore specific signs in more detail, helping you become even more informed and prepared. Remember, knowledge is power, especially when it comes to caring for the ones we love most. Lesson 2. Breathing changes that can't be ignored. Breathing is something we often take for granted, something that happens automatically without us even thinking about it. But toward the end of life, changes in breathing patterns can be one of the most important signals that the body is nearing its final stage. Understanding these breathing changes is crucial for seniors, families, and caregivers, as it helps provide the right comfort and reassurance during this sensitive time. Doctors and hospice experts agree that breathing irregularities are among the most common signs that death may be near. These changes can sometimes feel frightening or confusing to witness, especially if you don't know what they mean. But recognizing them for what they are, a natural part of the body's transition, can ease anxiety and help everyone involved feel more prepared. One of the most noticeable breathing changes is called Cheney-Stokes respiration. This is a pattern where breathing speeds up and slows down in cycles, often with periods of shallow breathing followed by deeper breaths, and sometimes even short pauses where breathing seems to stop momentarily. Although this may look alarming, it is a natural response as the brain adjusts to decreased oxygen and changing blood flow. Another common sign is agonal breathing, which involves gasping or labored breaths. This can occur when the body is struggling to get enough oxygen. While it can be distressing to see, it usually doesn't cause discomfort to the person and is simply the body's way of coping in its final moments. It's important to understand that these breathing changes don't necessarily mean the person is in pain or suffering. Often, they occur because the body is gradually shutting down systems that are no longer needed for survival. For caregivers, this means the focus should shift to keeping the person comfortable, using gentle reassurance, adjusting positioning to ease breathing, and maintaining a calm environment. If you're caring for a senior experiencing these signs, it helps to remember a few simple tips. Keeping the room well ventilated and free of strong odors can make breathing easier. Elevating the head or turning the person slightly to the side can also reduce the effort needed to breathe. Sometimes, doctors may recommend using a fan or humidifier to soothe dry airways. One question many families ask is whether oxygen therapy is helpful in these situations. While oxygen can be beneficial for some conditions, near the end of life it may not always improve comfort and can sometimes cause discomfort. Always consult with healthcare professionals to decide what's best for your loved one's unique needs. Another key point to remember is that breathing changes may come and go. A senior might have periods of steady breathing followed by irregular patterns. This ebb and flow is part of the natural rhythm as the body prepares to say goodbye. It's also normal for a person to be less responsive or slip in and out of consciousness as these breathing changes occur. This is part of the body's way of conserving energy and focusing on essential functions. By understanding these breathing patterns, families can feel more at ease when they happen and provide loving support without unnecessary worry. It's a reminder that death is a natural process, not something to fear but something to approach with compassion and care. In the next lessons, we'll explore more signs that the body gives near the end of life, from sudden weakness to changes in appetite, helping you become even more prepared to support your loved ones if you or someone you care for is showing these breathing changes. Don't hesitate to reach out to hospice or palliative care professionals. They can provide expert guidance, pain relief, and emotional support to help make this time as peaceful and dignified as possible. Remember, knowing what to expect empowers you to provide comfort and love during life's most delicate moments. Stay with us for the next lesson to continue this important journey of understanding. Lesson 3. Sudden weakness and fatigue, what it really means. As we age, a little tiredness here and there is expected. But when sudden, profound weakness appears, seemingly overnight, it can be a silent message from the body that something much deeper is happening. For seniors nearing the end of life, this overwhelming fatigue is more than just exhaustion. It can be one of the clearest signs that the body is beginning to shut down. This kind of weakness often takes loved ones by surprise. A person who was able to walk around, hold a conversation, or even eat on their own may suddenly need help with the smallest of tasks. They may struggle to sit up, hold a glass of water, or even open their eyes for long. For families, this change can feel both shocking and emotional, but understanding why it happens helps to bring peace and preparedness. So, what exactly causes this sudden fatigue? As the body begins to slow down in the final stages of life, it naturally starts conserving its remaining energy. Vital systems such as the digestive, muscular, and circulatory systems reduce their activity. The body no longer prioritizes movement or alertness. Instead, it directs energy to maintaining comfort and essential internal functions. This process is not painful in itself. In fact, many seniors report feeling calm or simply tired during this phase. One of the important things to remember is that this weakness is not a failure. It is not something that needs to be fixed. Rather, it's a natural, expected part of the journey. Recognizing and accepting this helps caregivers shift their focus from trying to restore energy to offering gentle support, reassurance, and compassion. Caregivers and family members can play a vital role here. Adjusting the environment to reduce the need for movement, such as placing water and medications within reach or using bedside commodes, can make a big difference in the person's comfort. It's also important to allow the person to rest as much as they need. Pushing them to be more active may cause distress or discomfort. Communication may also slow during this time. A person may speak less, respond more slowly, or simply prefer to listen. Don't take this as a sign that they don't care or aren't aware. Often, they are simply too tired to engage fully. Gentle, loving presence, a soft voice, holding hands, or quiet companionship can speak volumes during these moments. From a medical perspective, there's no cure for this type of end-of-life fatigue, nor should there be. It's the body's natural way of letting go. However, professionals in hospice or palliative care can offer guidance to make sure the person stays comfortable, pain-free, and emotionally supported. Families often ask, should we be worried about this sudden weakness? The answer depends on the larger context. If the person is nearing the end of life and other signs, such as changes in breathing, appetite, or mental alertness, are also present, this fatigue is part of the process. It's time to shift priorities toward comfort care, emotional presence, and meaningful goodbyes. Above all, remember that the body knows what it's doing. This decline in strength is not something to fear, but a sign that the body is taking its final steps with quiet dignity. It's a time for families to come together, not with panic, but with peace, love, and understanding. In the next lesson, we'll talk about changes in body temperature and skin tone, another important signal that doctors and caregivers pay close attention to. These insights will continue to help you navigate this tender chapter with knowledge and compassion. Stay with us as we guide you through every step, because knowing what to expect can make all the difference. Lesson 4. Unusual body temperature and skin changes, what they reveal. As the body nears the final stage of life, it begins to speak in ways that are quiet but deeply meaningful, especially through changes in temperature and skin appearance. These physical signs may seem subtle at first, but they are powerful indicators that the body is preparing for its natural transition. For families and caregivers, learning how to recognize these changes can provide comfort, reduce confusion, and help ensure loved ones are supported with calm understanding. One of the most common changes involves body temperature. Seniors approaching the end of life may suddenly feel much colder, especially in their hands, feet, and lower legs. This happens because the body begins to reduce circulation to the extremities, instead preserving energy for the vital organs. It's the body's way of prioritizing what matters most in its final days or hours. This cooling of the limbs may be accompanied by a noticeable drop in overall body temperature. Loved ones might observe that the person seems unusually chilly or asks for extra blankets, even in a warm room. Adding soft layers or using warm, non-electric blankets can help maintain comfort. However, it's important not to overheat the room, as sensitivity to temperature can fluctuate. Along with temperature shifts, visible skin changes can also occur. Skin may become pale, bluish, or mottled, a pattern of patchy discoloration often seen on the hands, feet, or knees. These changes are known as mottling and are common near the end of life. They happen when blood flow slows down, especially in the outermost parts of the body. To the untrained eye, these changes can look concerning or even alarming. But they are not signs of pain or suffering. Rather, they are natural effects of the body's internal systems slowly shutting down. Knowing this can help families avoid unnecessary fear and instead focus on being present and providing loving care. Dry or cool skin is also common, and it may feel different to the touch. Applying gentle, unscented moisturizer can help reduce dryness and add a sense of comfort. At this point, it's not about fixing the appearance but about offering connection and care through touch and presence. Some people may also notice a waxy or pale appearance to the face, which can be emotionally difficult to see. But again, this is simply part of the body's natural decline. It's not a medical emergency, and in most cases, it doesn't indicate that the person is in pain or distress. Staying calm and supportive is one of the most meaningful things you can do in this moment. doctors and hospice professionals emphasize that these signs are expected and are not dangerous. They are just a part of the body's journey as it begins to let go. When families are aware of these indicators, they can be more emotionally prepared and less fearful. They can also focus on what matters most, being close, offering words of love, and making the person feel safe and cherished. It's important to keep communication open with healthcare providers during this time. If there are concerns or if you're unsure whether a change is part of the dying process, hospice teams can provide reassurance and explain what's happening. Their expertise can ease uncertainty and offer peace of mind. In the end, recognizing skin and temperature changes as part of life's natural cycle helps bring clarity and compassion. These signs remind us to slow down, be present, and honor the dignity of the person in front of us. In our next lesson, we'll explore what happens when appetite and thirst decline, and how you can provide loving care when eating and drinking are no longer priorities. Stay with us. Each lesson brings insight, comfort, and a deeper connection to what truly matters in life's final moments. Lesson 5. When appetite and thirst fade, a gentle signal from the body. One of the most emotional experiences for families and caregivers is watching a loved one stop eating and drinking. It can trigger concern, confusion, and even a sense of panic. After all, we grow up believing that food and water are essential for life, and they are. But near the end of life, the body begins to tell a different story. A fading appetite is not a sign of giving up, it's a natural and expected part of the body's final journey. Understanding why this happens can bring relief and help us respond with compassion rather than fear. As the body prepares for its final stage, it gradually slows down many of its functions. The digestive system, which once worked hard to process meals and absorb nutrients, begins to rest. The body no longer needs fuel to support activities or healing. Its energy is being conserved for the essential task of shutting down gently and peacefully. In this stage, seniors may begin to eat less, refuse favorite meals, or show little interest in food. Some may stop eating altogether, accepting only sips of water or small bites occasionally. While this can be emotionally difficult to witness, it's important to remember they are not starving. They are not suffering from hunger in the way we might imagine. The body simply doesn't require the same input anymore. Thirst often fades too. The sensation of being thirsty diminishes as the body's metabolic needs change. Offering fluids gently, like moistening the lips or providing ice chips, can bring comfort without forcing unwanted drinks. Trying to push food or water can cause discomfort, including choking, nausea, or bloating. At this stage, comfort is far more important than nutrition. For families, letting go of the idea that food equals love can be one of the hardest parts of the end-of-life journey. Many people feel that preparing meals and feeding loved ones is an expression of care. And it is. But in this phase, love looks a little different. It's found in soft words, warm blankets, holding a hand, or playing familiar music. These small acts offer nourishment for the soul, even when the body is no longer asking to be fed. It's also important to communicate with healthcare providers during this time. Hospice and palliative care professionals can guide you on what to expect and how to support comfort without forcing intake. They may suggest simple ways to soothe dry mouths or recommend mouth swabs and balms to prevent discomfort. The emotional weight of this experience can't be ignored. Watching someone you love eat less, fade, and pull away from the physical world is heartbreaking. But it's also a time of profound connection. Many families find that in these quiet moments, free from distractions like meal preparation and medication schedules, they are able to focus on presence, gratitude, and saying things that matter most. Some people ask, is there anything we should be doing when eating and drinking stop? The answer is yes, but it's not what you might think. Your role becomes one of witness, comforter, and gentle companion. Be present. Share stories. Sit in silence. Offer love without expectation. These are the gifts that truly matter in life's final days. As the appetite fades, it can actually signal that the person is at peace with their journey. It's not about giving up, it's about letting go in a natural, calm way. When we understand that, we stop fighting the process and start embracing the sacredness of this time. Conclusion. We hope this video has given you clarity, comfort, and understanding during one of life's most delicate moments. Recognizing these signs is not about fear, it's about preparing with love, dignity, and care. If even one part of this video helped ease your heart or opened your eyes, we kindly ask you to share your thoughts below. Have you witnessed any of these signs in someone close to you? What would you tell others who may be going through the same experience? Your story could be the comfort someone else needs right now. So please, leave a comment, share your experience, or simply say what touched you most. We're listening, and your words truly matter.